A very good evening. You're joining us at Hyde Park on AdaDerana 24 as Sri Lanka battles to handle and manage the ongoing effects and challenges of the highly mutating variant of the COVID-19 coronavirus that the entire globe is challenged with currently. We thought of talking about Sri Lanka's inoculation drive. The President said that Sri Lanka will achieve full inoculation of over 30 population by mid-September. Where do we stand today? How many doses more do we need here in Sri Lanka to achieve this target? And also to talk about the ongoing rumor about a drug shortage in the country. We've invited to our studios Chairman of the State Pharmaceuticals Corporation and member of the Special Committee on COVID-19 Control, Dr. Prasanna Gunasena. A very warm welcome, Doctor.
Hi, how are you?
I think you've been very busy talking about the ongoing drug situation in the country with the imposition of price increases. But before we go there, I wanted to ask you about the inoculation drive. I think on the 20th of August, the President himself said that by mid-September or the first 2 weeks of September, we should be able to complete full inoculation of the over 30 population. And the government also have plans, you said, to start inoculation of above 18. Yeah. Where do we stand now?
Yes, if I'm going to describe it in brief, as we all know, we started our vaccination program end of January 2021, this year. Mm-hmm. So we initially started, but due to few issues with the Indian COVID spread, we had to slow down our vaccination program to a certain extent in between. Mm-hmm. But from May onwards, we have been vaccinating at a reasonable speed. And currently, if I give the figures, mm-hmm. we have got down, purchased 16.37 million doses of vaccines, namely Covishield, Sputnik V, Sinopharm and Pfizer. Mm-hmm. And we have got another 6.8 million doses of Covishield, AstraZeneca, Sinopharm, Moderna and Pfizer as donations. Mm-hmm. So altogether it comes to about 23 million doses. And so far, out of that, we have been vaccinating a population above 30 years up to the date. Right. And on 5th, mm-hmm. we are getting another 4 million doses of Sinopharm, and every week we are getting about 80,000 to 100,000 doses of Pfizer, and we are expecting to get another 14 million doses of Sinopharm and Pfizer. Pfizer 4 mm-hmm. million and mm-hmm. Sinopharm another 8 million by early October.
Right.
So the Sinopharm total quantity of another 8 million will come this month, mm-hmm. and Pfizer will continue to provide their vaccination. So by that, we are going to achieve, we are going to get 35 million doses, 35.5 million doses to inoculate Sri Lankan population. Mm-hmm. As we know, if we divide it by 2, it comes to about 17.5. Mm-hmm. So out of our 23 million population, 17.5 million populations means roughly about 18 or even above 15 population comes to that number.
Right.
So basically speaking, now at the moment we are planning to, we are giving the vaccine above 30, but concurrently I think now most of the areas the vaccination is going on, and I think very soon above 18 will be inoculated. Very
when
soon.
Do you expect
I think probably,
that to happen?
Probably this week or next week. Mm-hmm. Within next 3 days we are getting another 4 million of Sinopharm. Mm-hmm. So basically speaking, we don't have that much of population to give the second dose. So it'll start concurrently. We can't say we completely finish above 30 population and then start below 30. Right. It usually once a certain number is given, mm-hmm. then automatically the people who are below that age group can be inoculated. Mm-hmm. And so when we are doing that, initially, as we know, we need to take 2 doses of vaccine, mm-hmm. and another 2 weeks for us to get the full immunization. So now see, supposing if we take the population who had 2 vaccinations by the end of 31st of August, we have had about 80% of population above 18 had their first vaccine, and about 52% of the population had both vaccines by 31st of August, above 18 population. Now within the next 2 weeks, that population, that 52% of the population will get the full immunization, whatever the vaccine they had. So based on this evidence, now we are seeing a trend of requirement for the oxygen. The critically ill people start to come down slowly. And by mid-September or towards the end of September, we can see clearly these changes happening in the clinical setting in Sri Lanka. But we need to be very cautious because there is a huge number of partially vaccinated population in Sri Lanka. 1 million, say if you say 3 million, it's a huge quantity. Now say among these 3 million, if we get severely infected people, say about another 50,000, then we are again facing a problem. So very important that we need to maintain the quarantine laws, the principles, the social distancing, and all the principles taught to the society to be continued until at least by early to mid-October, but even beyond that, based on the situation, as you said, there are certain variants coming in, and at the moment all our vaccines are good for these variants, but we don't know in future there may be changes. So keeping everything in mind, we have to go very cautiously, because we have experience after the first lockdown, we relaxed, and then we got the second wave in a bad mood. And in the second wave, we started to control it, but after the new year, again, we got a severe outbreak of the illness. So even at this stage, we have got some protection with vaccination, but there are certain countries who had Pfizer, like for instance, Israel, and if we take UK, and even New Zealand, Australia, everywhere, even with the vaccination program going on, there is a risk. I'm not saying it's going to increase the death rates or severe disease, but there's always a risk of getting a minor illness or moderate illness in the society.
How do you assess the risk of the above 60 population so far, Doctor? We've been talking about achieving full inoculation of the above 60 population. Where do we stand, and what is the risk faced by this population as of now?
Of course, the primary goal was to vaccinate the total population of above 60, but unfortunately there are pockets where the above 60 population could not get the access to the vaccines due to various technical issues. Probably some people were not mobile enough, and some were afraid to get the vaccine. Now see, if that number is about say 50,000, even in the whole country, that 50,000 carries a very high risk with Delta population. So that is the reason that wherever anybody who is above 60 or a person who is taking medications for chronic illnesses need to go and get the vaccination. Even currently, at the moment, out of deaths, more than 70% people are above 60 years. So we know that the high risk group is in the above 60 group with chronic illnesses. Even if you are younger, if you have chronic illnesses, you carry the risk. At the same time, this morning I read an article about children, even children who are having chronic illnesses like heart disease or lung disease or cancers, they carry the risk of developing the illness. So irrespective of the age, the chronic illness is important. And when it comes to age, above 60 is important. So we need to target that. And any healthcare worker in this, listening to this one, they need to concentrate and encourage people to go and get the vaccination at the correct time.
You did say earlier, Doctor, that we should be able to complete inoculation of the full population, or the estimated the number of the population by early October. Are we on course? And you mentioned the number of vaccine doses that are expected to arrive in Sri Lanka. Is that sufficient? Do you need to mobilize more access to vaccine availability to the country?
Well, basically speaking, the last few months our predictions were all right, but we were expecting another additional million to come last August. but because of the Chinese, the pandemic situation, that 1 million delayed to this to the 5th.
Okay.
So that is the reason here and there is a bit of deficit. But other than that, this total quantity we are getting down is coming definitely. And in addition to that, we have ordered another 14 million doses to be used to any needy categories for the 3rd dose or a booster dose or protective another additional dose, whatever the name you give. We have secured another 14 million doses of Pfizer vaccine, which is a mRNA type vaccine, which can be given as mix and match for any other vaccine given to the population. So we have that reserve coming in towards the end of October and November, December. So that is also there. So definitely there won't be any inadequacy of doses, and the regular delivery of the vaccines are also happening at the moment. We haven't got any issues. I think the Chinese government has confirmed that they are now shipping taking the vaccines to the airport, and 4th night or 5th early morning we are getting another 4 million. So that's basically happening, and every Monday the Pfizer vaccine is also coming. So it's a very solid and regular supply chain of vaccines we are getting, and according to the delivery of vaccines, I think the rollout has to be time to time adjusted due to various logistic things, how it is going to go there, where are we going to store, and once sometimes some areas when the vaccines go, there will be bit of less turnout, then some vaccines will be there, but certain areas more people will go and it will be over. So that kind of discrepancies can pop up time to time, but at the end of the day, our total population is 23 million, and if we get down concentrating to inoculate 17.5 million population, then the total number should match. So there can't be any discrepancies. So at the end of the day, even though there are discrepancies here and there at the moment, everything will settle towards the end of September and mid-October. So that is going to happen.
I think there is a massive concern among the population also about the efficacy of these vaccines still, because as we all know, we were talking about the alpha variant back in the day, and most of these vaccines were targeted in combating the effects of the alpha variant. But now we're talking about the delta variant, and I think you can give us an explanation to this, Doctor, the highly mutating nature of this variant and the efficacy against of these vaccines against this variant. How do we assess that now? People are concerned about that.
That's exactly correct. The people are concerned. Now currently the WHO has done, they get all the results from the whole world, and all the variants currently existing in the world, the vaccines are effective against those. Now effectiveness is considered based on the ability of vaccine to control severe disease and death. And now that comes to more than 97%, any vaccine, irrespective of the type. So to control severe disease, either it is Pfizer, Moderna, Sputnik, Covishield, or Sinopharm, Sinovac, everything is effective according to the WHO recommendations. However, now we are talking about 97%. Now 97% means if you take 100, there is always 3 people who are at risk. Now when it comes to 1,000, it is 30, and like that the number can be more. Now that is the important thing to remember. Now even if you are 2-dose inoculated, if you are having a lot of risk factors and unnecessarily exposing yourself to a high load of viruses, you need to understand this. Now see, when you are just coming into contact with a person for 2 seconds, the viral load that is going to come into your body is small. But supposing if you are going to be with a group of people who are infected in a closed room, and if you are an elderly and high risk person, the viral load that you are going to get in is more. When the viral load is more, the effects of the disease, the severity of the disease definitely going to be more, and you are going to face more problems. So if you are a high risk person, then it's better to avoid such encounters even though you are double vaccinated. So that message has to be very clear Because if we forget about that and say, okay, right, everything is done, now we are fine, that kind of attitude is very dangerous, because you know the vaccine inoculation, the protection, everything always has a statistical percentage of protection. So that we have to keep it in mind.
You earlier mentioned that health authorities are in consensus over the need for a booster shot. But is there broader agreement about this, and what's the current stance?
Well, the decision is taken by ACCD. There's a committee who decides upon the type of vaccines, the inoculations and the decisions. And they have actually summoned me to one of their meetings in May, and they recommended to get ready for a booster if necessary. So based on their recommendation, we spoke to, and actually they unanimously decided that Pfizer should be the additional dose or booster dose or whatever the name you give. And based on that recommendations, we started discussions with Pfizer, and they agreed to give us the additional doses, and we have secured that. And World Bank has agreed to pay the total amount for this additional 14 million doses. And they are paying, within next 2 weeks, they are paying the advance payment, and by 10th of October, they will pay the total amount. So once it is done and everything is done, for that to come to Sri Lanka. So any person who miss any of these vaccines also have a chance to get the vaccine, because then we are having adequate number of vaccines to all whole Sri Lankan population, about say 12 years or 15 years we can say.
Apart from the donations made, Dr. Gunasena, what kind of funding availability does Sri Lanka have in the procurement process? What's the level of funding that is mobilized towards this?
Yes, I think this is a very important question that you have asked. So far, we have spent 29 billion rupees, 29.24 billion rupees for the vaccines that we have purchased.
Right.
And for the additional doses, as well as the booster, we have to pay another 36 billion 0.19 for the vaccines to come. Now the total will come to say 66 billion times 65 billion rupees, and usual Sri Lankan budget is about 58 billion rupees. You can understand the amount the government has to pay. Now in the finding money was also a challenge, but we as the State Pharmaceutical Corporation has been qualified by both World Bank and Asian Development Bank based on their procurement guidelines, counter-corruption, anti-bribery guidelines we have been following. So they both qualified us. I think the World Bank has qualified us as the first country in the Asia. ADB also the same thing. So we are, as a nation, we should be proud of that. And the payment, of course, for the Pfizer, no issue, because they have agreed to their counter-corruption guidelines, and Sinopharm also has agreed, and today I think it's going to be finalized. So even retracted financing, like for the vaccines we have purchased, the ADB will be paying to the past, and also for the future consignments they will be paying. So everything for the purpose of vaccination to this year we have secured. Now
we have settled or secured?
Settled, basically.
Okay,
everything is settled. It's all done.
Okay.
It's all done. Nothing to worry, because they have given the guarantee. They have shown the money. It's a matter of giving them the invoice.
Right.
And when the invoice is given, they will.
And Sri Lanka has to honor our liability to these organizations eventually.
Yes, that's right.
Okay.
That's right. And only thing is, we need to remember that supposing if the next year also we face the same situation, this is a very serious burden to our economy to spend this much of money just for the vaccines. So we need to think of some mechanism to earn finances or share the burden of finances if we have to continue the problem.
The WHO recently cited a projection that Sri Lanka needs to lock down the country for at least the first week of October to prevent an estimated number of 10,000 deaths in the country, or lose massive amount to the economy. I know you're not, you wouldn't comment on the economic loss at the moment, Doctor, but in terms of the prevention of deaths, managing the people's health and lives, how do you think the question of locking the country and managing the health crisis here. How do you look to strike a balance here?
Well, I think you have made a point. You said that WHO has made a recommendation. So we inquired from the WHO, and WHO has given us a reply saying that WHO Sri Lanka has not released any recommendations on the COVID-19 quarantine curfew or issue any statement of the media on that matter. So WHO Sri Lankan office categorically says they have not given any directive to such effect. But as you tell very correctly,
this is just
it was in the media. Yes, it was published like that. But leaving all these things aside, what we have to concentrate, the WHO recommendation is the people or the countries have to decide in the quarantine law, considering the social, economic, and the available cultural situations in a country. And at the same time, they say, based on these criteria, if a country is going to relax the quarantine laws, they need to give due consideration to the pattern of disease spread. Now, at the moment, we have been, having this quarantine law imposed for the last 2 weeks almost, and we have to decide whether we are going to continue in the same way future or not. Now, basically speaking, if we just forget about everything else and only think about the health, lesser the number of people get into contact, better we control the disease. That's pure and simple health advice. However, now as we know, the foreign reserves in a country, the day-to-day life of people, and the social impact of that, the psychological impact of that, and the long-term impact on small microeconomies are all a concern to a government to decide on that. So basically, as a health professional, we give our recommendations to the government, and the government will have to take a decision what balance they are going to have in order to run the country. Probably we need to implement the quarantine guidelines strictly. The method of following that guideline is the question, whether we just keep a curfew or emergency state, or whether we are going to relax the curfew but educate the people and make them to understand what is happening and then do it. Because this curfew in the pandemic or the quarantine curfew is quite different to a curfew imposed against terrorism.
Right.
Now in a situation of terrorism, if there is curfew, if someone comes out, he is a terrorist, and the army can shoot them down or take him into custody. But in this type of situation, maybe the person who is coming out is not, genuinely not trying to do any harm, but maybe he is having some serious issue he needs to settle. So even in this situation, I think the law implementing agencies faces the difficulty in sometimes turning the people back when they are on the roads. So that is the conflict that we are seeing at the moment. Some people say the law is not implemented properly. Some says we can't stay at home, we are hungry, our children had to be fed. So we need to take a balance of that, and essential things have to be continued, basically.
In your opinion, Doctor, what do you think should be the best course of action here, especially when we talk about the livelihoods of people? We're aware that many rely on daily their daily wage earners. At the same time, there's a health risk. But in terms of balancing this issue, it's delicate. But what's your personal opinion here?
Well, now if we take, if you ask me about how it has to be dealt, if we take for State Pharmaceuticals Corporation, that is my institution, I'm responsible for that. The whole period, even before this quarantine period, we have had a system where important areas of services to be protected. And there are certain things that we have categorized. We know everything is important, but we have a hierarchy of importance. And then we secured the safety of our people by using our own transport. And also simple things like checking the temperature and identifying early patients and separating them. And then we break down our working hours so that people won't overlap too much and the social distancing can be maintained, and how the eating patterns to be changed. So all these things have been done at the institutional level. Now, for a country, the most important thing is to adhere to that kind of regulations and have minimum contact with each other. But I know, practically speaking, all the institutions will not work like that, because I don't know, maybe because I am there, I have been looking into all these aspects. But people sometimes relax. So that is the issue. I don't have a direct answer to you, but I think the daily wage people should be given a chance to work, because very recently, just before this pandemic starts and the quarantine curfew starts, the people in the three-wheel park at Lanka hospital came around me. They knew that I'm going to this task force meeting and asked me, "Doctor, what is happening today? Are we going to have a curfew?" Then I said, "Not decided yet, but probably because of the situation, sometimes there may be a possibility." Even before I complete my sentence, everybody said, "Doctor, if you impose curfew this time, we are finished." That is what they said. So I think you can understand how they are thinking. If they don't have money to spend a day, then how are they going to feed their children? How are they going to take at least medicine they want? So these are quite essential things. They are not bothered about going on a holiday somewhere to a foreign country or going into a cafeteria and have a nice time in the evening.
It's about a struggle to
That's
survive
right.
the day.
Survival. It's a life and death situation to them. So if the government is in a position to give them a subsidy to keep them at home, if your country has money to do that, that's fine. But on the other hand, if we don't have, we need to at least give some chance for them to survive while keeping the majority of people out of the roads.
I think on that note, it's time we take a short commercial break here at Hyde Park. We'll talk more about the availability of drugs within the country. Welcome back. We are in conversation with Dr. Prasanna Gunasena, the Chairman of the State Pharmaceuticals Corporation and member of a Special Committee on COVID-19 Control. Dr. Gunasena, there has been a lot of criticism from many sections of society of an alleged shortage of drugs within the country. How do you first respond to this?
Yes, two types of information coming to us. People who are going to Osusala chain and they report certain drugs are missing in pharmacies. So that is actually a distribution issue. Time to time, in various places, the drug go out of stock, and then we need to provide it. And not only in Osusala chain, any other pharmacy chain will get the same problem. But by and large, we are talking about the drug shortage in the Department of Health, in our free health system. Now, I think most of the comments made regarding this drug shortage, we need to address in a scientific manner. I can't, if you take one individual drug and tell me, doctor, this drug is not available, maybe it's true. But we have about 1,200 varieties and dosage forms of medicines used in the Department of Health in all hospitals. Now, 2 days back, I got a report basically from the computer system about the stocks available in the medical supplies division. That gives a figure in the medical supplies division as well as the national level. So now we have vital drugs, essential drugs and non-essential drugs. Now vital drugs, everything is available. Life-saving, all vital drugs are available. Now
vital drugs are for, when you say vital drugs, these are aimed at? Like say the drugs used for anesthesia, drugs used for critical illnesses, those are life-saving medicines. And essential medicines are also important, non-essential medicines are also important. We can't say not necessary, they are necessary, but there can be a replacement for that particular medicine. Even if we don't give that drug and give another drug, we can replace. That is how this categorization is done by the Ministry of Health. Now, if we take the essential drugs, there are about
400 essential drug dosage forms, and out of that, day before yesterday, only 10 were not available. Out of that also, many drugs have not been there for a long period because it has not been used regularly, like say flucloxacin syrup, and there are certain tablet forms. But the reason, when we check the reason for these things, are there are no regular supplies for this small quantity. And if we take the non-essential drugs, also there are about 15 to 20 non-essential drugs which are not available currently. Now altogether it comes to about say 25 to 30 medicines which are not available in the whole country. Now out of 1,200, 25 to 30 not available is actually a very small quantity. When I took over this post, there were about 200 to 300 medicines not available at a particular moment when I started working in 2019, end of 2019. Now we have been regularly monitoring this, as well as we have handed over many essential drugs to be manufactured by a state pharmaceutical manufacturing corporation, and because of our methodology we were able to maintain reasonably good supply of medicines even during this pandemic. So basically speaking, the media conferences drug shortage is actually a artificially created drug storage. I must tell this thing because you asked me the question. Usually the method they have followed is, in the past they created the drug shortage in the media and they do a emergency procurement.
When you say they, you're referring to?
People who want to sell drugs to a higher price. That's the point I'm coming. Now they means there are people who want to sell their drugs to a very high and unreasonable price. I'm going to reveal you few medicines like that. And what happens is, when they say there's a drug shortage, everybody get panic. It become a political issue, it become a social issue, and the people also get panic that they are going to not get their necessary doses of this particular medicine. Then what happens is, the Ministry of Health recommend to go for emergency procurement. Emergency procurement means you just give few days and ask whatever the people who have the quantities in hand, and they purchase it. Now I'll tell you, this kind of purchasing has been done since I came. Now since last April we have stopped all emergency procurement. So far from last April up to now, no emergency procurements have been done. Now the famous cancer drug rituximab, that has been procured by emergency procurement to 55,000 rupees, and our normal tender price we have purchased last year, it was only 17,000. Now there are certain few drugs I would like to tell you. Now there's a drug called estradiol valerate, which is used as a hormone, and that has been procured as emergency for 1,482 rupees, and the normal price is 19 rupees.
So there's a massive
price
gap.
Massive price gap. And another drug, dexamethasone. I think you are interested about this COVID treatment also. Dexamethasone tablet, 4 milligrams. Emergency procurement price was 153 rupees, and our normal tender price is 6 rupees. So you can see the gap. And another price, aspirin. Everybody knows aspirin tablet. The normal tender price we procure 1.2 rupees, so 1 rupee almost, and emergency procurement 13 rupees. How many times more? And there's another drug called phenytoin sodium. Phenytoin sodium is a drug used for fits. We usually procured last year for 3 rupees, and it was procured for emergency procurement 113 rupees. Now there's a list of more than 150 medicines. These are all papers, and which is available in our website. We are going to publish it, and you can see how much people's, taxpayers' money have been drained into these emergency procurements before 2020. We have stopped everything. Still, we have to stop more because there are no other replacement supplies for these things. We are going to do that, and the amount of money that we saved is 1.146 billion rupees during 2020 only. So that is
by preventing this misappropriation.
And also that is actually we convert emergency procurement into normal procurement. And in the cancer group only, we saved about 2.26 billion rupees by going for normal tenders, stop emergency procurement and going for generics. So you can see more than $3.3 billion we have saved per year. And this is the money that has gone to the pockets of illegal businessmen who legalized their illegal business through the emergency procurement. So
when you say illegal businessmen, there should be some sort of regulation by the State Pharmaceutical Corporation.
Right.
Where does that come in? And who are these people who are really responsible?
This is the danger of this problem. If you take emergency procurement system, nothing is illegal. Nothing is illegal. That is the legal system that has been created to procure a medicine when it is really, really needed. But that legal the chance or the space given by the law has been manipulated to procure massive amounts of medicine to very, very high price. So nobody will be able to catch anybody. But there are certain things that has gone wrong, and I have given a list of these medications to the CID, and they are currently doing an investigations, because there are certain things that there are certain norms that you can't manipulate. We have found certain instances where the norms have been manipulated, and we have given that the investigations are going on. But the thing is, even if we investigate now, the loss has been done. Now in future, what we are trying to do is we need to regularize the system to avoid any drug shortage. Now we are talking about 25 drug shortages, but last month only we have got more than 70 requests from the medical supplies divisions to delay the consignments because there are overstocks.
Okay.
Now see, in one hand we have overstocks, the other hand we have short, out of stock going. Now the reason is we don't have a real-time data system to check the stocks, because our data system only goes up to the outdoor stores. From outdoor store, as soon as the drug is given to the indoor store, the computer makes it 0. And thereafter everything is paper. So there's a huge lead time to balance the stocks. That is the reason for the false calculations, wrong procurements, overstock, understock, all these problems. So
will we be looking at a digitalization process concurrently?
Of course, the digitalization process has been there since 2012, but unfortunately there are huge issues in changing the system from paper to digital. That's, I think, the problem in Sri Lanka as a whole. So we are pushing it hard. I think probably we will find a solution very soon.
Also talking about vaccine procurement, there have been talks with vaccine manufacturers in China about possibly beginning vaccine production in Sri Lanka. How viable is this idea?
Well, the thing is, currently, initially the proposal came from Sinovac, which is actually another WHO approved vaccine, and State Pharmaceutical Corporation has a partnership with a local manufacturer whose plant is in Pallekele here, and they have constructed their plant to manufacture intravenous drugs. So that's fairly a high standard manufacturing site, and the Chinese company agreed to upgrade it so that it can start filling the vaccine. Usually any plant which is going in the process of manufacturing has to start initially to maintain standards and fill. And the thing is, currently, because we are getting all the vaccines necessary, we are not in a position to procure any other vaccine, even though we are going for the manufacturing. However, the plant is being upgraded. WHO will go and check it, and if the WHO also gives the approval, any vaccine in the world, we can actually talk to the manufacturer and get it for the manufacturing in Sri Lanka. Supposing if we have to go on and on and on this vaccination program, I think the Pallekele plant will be a great asset to Sri Lanka. So I think State Pharmaceutical Manufacturing Corporation will be working on that.
Is there any clarity on the kind of funding for this project?
No, basically, as far as I know, there are no funding issues. They are actually funding for their own project. The government is not spending money for that.
The drugs approved by the WHO for the treatment of COVID pneumonia patients. Does Sri Lanka have enough drugs? I'm not sure if I pronounced this right. Tocilizumab and dexamethasone.
Yeah, dexamethasone, of course, not an issue. Tocilizumab, and also there's a drug called enoxaparin that has been used to prevent blood clots. Tocilizumab is a humanized monoclonal antibody. That is actually a kind of a blood product which has been manipulated in such a way to control overreaction of our immune system. Now that drug has been recommended very recently by the WHO to be given to a very small cohort of people, where it is confirmed that the patient has only COVID, no other infection. So that cohort of patients, that small number of patients only are eligible to get tocilizumab because it really brings down the immune response. Now, if a patient with a different infection get this drug, the drug can kill the patient. So that is the message the people should get. Unless a consultant who sees the patient and recommend, they should not take that medication. Now, end of July, State Pharmaceuticals Corporation has handed over 650 vials of this medicine to the Ministry of Health. Private sector, of course, I think there is a local agent, he has to procure and get it. But due to the current high demand after WHO recommendation, they are not in a position to give the promised quantities to any country. India quota is about 2,500 vials for the whole India. So I think we are working on that. Unfortunately, the original manufacturing company is not in a position to increase their quantities. We are closely, discussing these matters through the Switzerland embassy as well as the European Union, and there are certain regional office in India regarding this medication. It's been done. We are trying to make it available. I think in private sector also the local agent has to get this drug down, and another important aspect of this is because of the high demand, there's huge number of counterfeit drugs circulating with the same name. So it has to be very carefully chosen through the legitimate person, I mean the agent, because this can have contamination with hepatitis B, or sometimes even HIV is a possibility because they are all serum products. Therefore, go for the authentic supply. That is how it has to be done. I think we are expecting another very small quantity to the government sector within the next couple of weeks. We are working on that.
Going back to our discussion about the inoculation drive, has there been any consensus or idea about the vaccination of children as yet?
Well, that decision, the proposals have been, forwarded by the College of Pediatricians to the ACCD, which is headed by the Director General of Health Service. I think they will have to decide when and what is the age group that we are going to vaccinate if we are choosing children. Now, there are certain scientific articles published, especially based on the inoculation program of USA. But United Kingdom has not given vaccines to children, but European Union, has recommended both Pfizer and Moderna as a suitable vaccine to inoculate children. Based on this evidence, which is scattered, I can't say it's global, scattered evidence in different countries, our authorities, the health authorities, will have to sit down, review the data and take a decision when are we going to start and how are we going to give the vaccine to the children.
And pregnant mothers too, I think we heard in the news also that about 75 to 80% have been inoculated. How's the process so far?
Well, I think that has been started and smoothly happening. There shouldn't be any problem because both vaccines like Sinopharm and Pfizer are available. So if any doctor recommends, the necessary vaccine should be able to they should be able to access to the necessary vaccines.
I'd also like to refer to the recent price hike of essential drugs. Was that necessary? Because this seems like a massive burden on people with comorbidities, and at the same time, with the economic burden due to the lockdown, it seems like a massive burden on the people. But what was the necessity in this?
Well, I think it has been decided by the Ministry and the Finance Ministry, Ministry of Health and the Finance Ministry, based on the dollar fluctuations that happened during the last few years. However, the prices of State Pharmaceutical Corporation, we are trying to maintain as much as possible within the previous prices. And State Pharmaceutical Manufacturing Corporation, who is the leading manufacturer of all these medications for comorbidities, will be doing it to the most reasonable price without any such price hike. But the thing is, for the businesses to run also, I think their grievances have to be listened by somebody and has to be addressed. But as state agencies, we are taking all steps to maintain the reasonable, affordable prices that has been there in our State Pharmaceutical Corporation Osusala network. We will be doing that, and if anybody who face the problem of getting their doses when the prices goes up, they can come to us. Unless it is a branded drug, the generics we will be able to provide, and more than that, we have already ordered the almost necessary pharmaceutical items for this year as well as to certain months in the next year. Therefore, if you have any difficulty, please go to hospital and get your medications until these matters are properly sorted.
Finally, Dr. Gunasena, I think the question of whether people with other challenges, health complications, whether they have been forgotten throughout this pandemic period. It is understood that there is priority given to COVID patients, but at the same time, patients facing other complications, we've seen them having essential and necessary treatments that they sought from the healthcare system. But what is the procedure here? Because there's a lockdown currently, and there are patients who face massive challenges, and we cannot also forget the mental and psychological challenges that people face.
Well, I would like to start from this mental and psychological challenges. That is why the community involvement in actually deal with the stigma, bound to this COVID pandemic. Anybody who is cured will be of no danger to the society, but they will have a lot of symptoms, the body aches, the lethargy, the psychologically they are down, and shortness of breath, and many symptoms. So they need support from their families, support from their working place, as well as the community who is around should actually support their families. Sometimes the father, who is the only earning person, may be in this situation. So then the family needs some support. That is where the community support to the treatment centers as well as to the intermediate centers and to the communities spreading in the whole country. I think somebody should start that humanitarian operation at this stage. I think we know that Derana is doing that to a certain extent, and basically the whole concept should go through the mass media, responsible mass media, that we need to look after our community. It's not the money, it's just how we share our experience, how we help each other at this critical moment. This is a very, very important question that you asked, and I think nobody has been discussing this in length and to the depth. I think that's very, very important thing to discuss. And if you talk about this hospital management of other illnesses, in England, UK or any other country during the peak of the pandemic, what they did was they separated 3 or 4 wards to manage the emergencies. And the staff who are actually trained to do the cardiac emergencies, the surgical emergencies, pediatrics and gynecological emergencies, obstetric and gynecology, they have been looking after the emergencies. The rest of the whole hospital has been dedicated to COVID. And in Sri Lanka also, I think to a certain extent that policy has been maintained. But very soon, the time dedicated for normal patients can be increased as the COVID pandemic settles. Until such time, I think only emergencies will be able to manage. And clinic patients, of course, getting their medications by post and various other means. And Osusala, our State Pharmaceutical Corporation, maintain a home to delivery system at the moment for the medication. So like that, there will be difficulties during this period. I think we hope for the best and prepare for the worst and hope for the best at this moment. I think we should be able to come out of this situation very soon.
Thank you very much, Dr. Gunasena, for your time here. I know it's a very busy time for you, but thank you for sharing your insights and advice to the general public. We had with us Dr. Prasanna Gunasena, Chairman of the State Pharmaceuticals Corporation, member of the Special Committee on COVID-19 Control here in Sri Lanka, as we manage and control the ongoing pandemic situation and the challenges, the economic challenges faced by the country. Thank you for watching at Hyde Park on AdaDerana 24.